All right. Hi, everyone. Thank you so much for joining us today. My name is Anya Semenoff-Petty. I am the ministry coordinator at Our Lady of Lourdes Parish. And today we are really excited to introduce to you and welcome Elizabeth Higbie. She's with St. Raphael Counseling, and she's going to just talk with us today about just a whole myriad of issues that many of us have probably faced in some capacity, either personally or with loved ones. So thank you, Elizabeth, for being here today.
Absolutely. Thank you for having me.
Wonderful. So first of all, can you just tell us a little bit about yourself and what you do at St. Raphael?
Absolutely. So I'm a licensed clinical social worker. I do therapy, individual therapy, marriage counseling. I specialize in trauma treatment with EMDR, which is an acronym standing for Eye Movement Desensitization and Reprocessing, which is a whole bunch of words that basically mean reprocessing trauma in a way that helps people to move past things that have been traumatic in their lives. And that's kind of where I focus my work, but I do a lot of work with anxiety and depression as well in that setting.
Yeah. And how long have you been with St. Raphael?
Gosh, I've been there coming up on 6 years.
Wow.
St. Raphael Counseling started about 10 years ago. I think I'm getting that wrong. Hopefully Jim doesn't get on me for saying the wrong amount of years.
Roughly
I think it's been about 10 years. And it was started as a small private practice with the mission of really serving the church in this need for Catholic counseling that kind of is faithful to the magisterium of the church and the teachings of the church, and also integrates faith into treatment for a more integrated approach, right? To make sure we're treating the whole person when we look at symptoms of depression, anxiety, difficulties they're having in their life. We're taking into consideration the spiritual, the emotional, psychological, all at one time. So started out as a small private practice, continued to grow through the years, and then about 2 years ago, we actually merged with Catholic Charities, had an existing clinical practice as well. And so now we're one giant, awesome practice. We've got, I think it's like over 18 therapists now. We've got counselors in schools, Catholic schools throughout the area. We've got offices all over the metro area. Really, it's grown to be quite an amazing thing.
That sounds amazing. What a service and what a gift to Catholics in this area. So that's great. So to kind of dive in, can you tell us what are some of the benefits of like a faith-based practice in counseling versus other practices? Exactly what you're describing. Like what are the benefits there?
I think it's kind of twofold. So if we look at it from the client perspective, clients really range. I'd say there's a big variety in why they want a Catholic counselor. Some people come in and they say, it's just enough for me to know that you're Catholic. I don't need to talk about faith. We don't need to pray. I just want to know that you're Catholic, you respect my faith and my beliefs, and you're not going to like make fun of me for going to confession, basically, or tell me my faith is why I feel so guilty, which these are real things that people have experienced in secular counseling settings. So I think we've got that one end of the spectrum. And then on the other extreme, we've got people who are, their spirituality is so central to their life, and they want to bring their relationship with God and their prayer life and their experience of life, of their Catholic faith, into the counseling setting in a very tangible way. And sometimes that does involve praying in session. Sometimes that involves, thinking about their problems through a spiritual lens and remembering who God is in the context of what they're experiencing in their life. So there's really a variety of kind of on the client and what it means to them. As a therapist, I think we would all at St. Raphael Counseling agree that it just feels complete, right? I sometimes think, what would it be like? I've only done faith-based counseling as far as in an outpatient setting anyway. And I can't really imagine not bringing faith into discussions about mental health and emotional well-being and relationships, and all of the challenges that we face in life. So it just feels complete. It feels like an integrated way to be treating the person.
Yeah, that makes total sense. I just have like thinking about healthcare, like physical healthcare. Like I've had both, where a secular healthcare provider and a Catholic healthcare provider, and it is, like you said, just like so starkly different. It's just a different conversation from the second you sit down, So
Absolutely.
Total sense. So depression is the #1 disability in the country among individuals aged 15 to 44. In an article that you wrote, you referred to it as an epidemic. Can you kind of define depression for us? What are the symptoms? How does it differ from, quote unquote, feeling sad? And why is it that so many individuals are suffering from this right now?
I'm so glad that you asked the question, how does it differ from feeling sad? Because I think we can tend to over pathologize normal human experience sometimes. So the reality is sadness is a normal human emotion. It's one of the emotions God gave to us, right? It's not bad. It's often appropriate in response to many different experiences that we have in life. And so we don't need to, oh my gosh, I'm sad, maybe I'm depressed, right? We don't need to jump to this kind of catastrophic view of sadness being bad. Sadness can be really productive and healing in certain times of our life. So the way we look at it, though, is this a persistent state of being? One of the things that I have my clients do who are struggling with depressive symptoms is use a mood scale. And this is a very common cognitive behavioral intervention that therapists use to help clients to track their mood over the course of days, weeks, months, to actually see how are they feeling day to day? Do they feel better in the morning and worse at night? Are they just consistently really low? And I always say to people, a 10 out of 10 on the mood scale is like your wedding day, your child was born, you just got a really cute puppy. Most days, most of us are not walking around at a 10, and that's normal. 6 to 7 might be where we are most of the time, right? On average, like, yeah, I'm okay, I'm good, I'm happy. We have moments of happiness and joy. We have moments that are not so great, but generally we're okay. When we start to see persistent low mood, that's when we worry. One day of a lower rating on that scale is not really something to be concerned about, right? You might have a bad day at work. You might have an issue with your boss, or a fight in your marriage, or conflict with a family member. Your kids are driving you nuts and you're feeling really low, right? There's lots of things that can lead to momentary low mood. It's when we see day after day, and sometimes week after week and month after month, that somebody is experiencing low mood along with fatigue, low energy, difficulty motivating, a withdrawal from previously enjoyed activities. So if you used to love to go running every day and all of a sudden you're not doing that at all and you have no interest in doing it, that's a big red flag. Feelings of hopelessness, so not being able to see any hope for the future or think about, what might be on the other side of this experience. Those are all concerning signs that we just want to watch. So when we see these symptoms persist over a period of days, weeks, usually it's at least 2 weeks where we start to really be concerned. As far as why are we seeing such a big increase in depressive symptoms, I think, the article you're referring to is the one that was in response to the celebrity suicides.
Right, yeah.
And I talked about meaning in that article, and I really do believe that we've got kind of a cultural crisis of meaning. Increasingly secular culture that we have, people are just living for the day, right? Which, sounds great in theory, woohoo, right? Do whatever makes you happy, pursue, this thing that leads to this momentary pleasure, this momentary joy, right? If that's what we're chasing, and then we realize that on the other side of that, there's actually not much substance, that at the end of the day, we're frail, fragile human beings. Our life on earth is going to end. When we come face to face with that, then it's what's left, right? And it's one of the things that's beautiful about our faith and has been shown time and time again in studies, is that faith is really a source of resiliency for people when it comes to mental health. And it can really provide that hope, even when practically there's not much hope to be seen in someone's circumstances.
Right. Yeah, that makes so much sense. I'm reminded of this sort of common refrain you'll hear from the secular world often, is like, find your truth, live your truth, and when it's something that is so variable like that from person to person and day to day, as you say, like, how can you possibly find any sort of long-term resilience in that?
Yes, and people have made happiness and fulfillment, right, their God, right? These idols of, if I'm not happy, it's you always hear, well, if you're not happy in your marriage, you should probably leave.
Right.
Gosh, like, okay, you're right. I'm not happy. I've got to quit my job and leave my kids in my marriage, right? But then people find nothing on the other side of that. They're chasing this elusive feeling, this fleeting emotional state that really, it's just an emotion.
Yeah. So if someone is suffering from depression, what action steps should they take?
So a couple of different approaches. Some people go straight to counseling. I think that's a really great start. You can talk to your GP. You can always talk to your doctor about your depression symptoms. That can be okay. Just a warning, some people's experience is that general practitioners are really quick to prescribe medication. So that will often be there for, they don't know, they don't do counseling. Sometimes they think, here, I've got this pill that might help you. And so that's their first kind of approach. Now, don't get me wrong, medication serves a valuable purpose, or it's valuable. It can be very helpful for people. However, I think trying counseling first makes sense because some people don't need medication. Some people are able to go to counseling, learn new skills, change the way they think about things, and really feel better relatively quickly. If there's deeper trauma or wounds underneath it that need to be worked through, that might take some more time. And sometimes medication and counseling are the best approach combined. So certainly there are times where a referral for medication is needed in order for therapy to be productive. So I would say the first step, if you feel more comfortable talking to your general practitioner, that's fine. Just be aware their approach is probably going to be medical focused. Right. And then seeking out counseling to really get a sense of what's the underlying root or cause of your depression. Sometimes there's really a biochemical cause, and for that, medication is wonderful. And so I think that's a good place to start. As far as things that you can do yourself without any treatment, without needing to pay somebody for support, these are the things that I always start with when somebody comes in with depression. Before I get into any cognitive interventions and trying to teach them how to unlearn negative thinking patterns or identify distorted thoughts. People with depression, just a side note, have a tendency to be thinking in very black and white terms. So it's all or nothing, or they see themselves through a very negative lens. So they don't recognize any positive things that they've accomplished or contributed, and they only see the things that they haven't done well. And so we kind of work on addressing some of those distortions through challenging those thought patterns and creating new neural networks in the mind. But before we can do that, and where I always start is really like the basics, right? Are you sleeping enough? This is really silly and elementary, but it's amazing the cognitive dissonance, how people will just they know sleep is really important, but yet they don't prioritize it. And then they come in, they're like, I don't know why, I am just so fatigued and I have no motivation to do anything.
Yeah. How
much are you sleeping every night? Well, my Fitbit tells me I sleep probably between 5.5 and 6 hours a night. Okay, that's not enough sleep, right?
Right.
Sleep is the most important thing that we can do to rest and restore our brains. It's critical for all of our hormones to be in balance. It's critical for our blood sugar. I mean, there are so many biological things that can impact mood, and that the lack of sleep actually can really cause disruption too and dysregulate. So I always start there. If you have insomnia, seek out treatment because you might need some medication, you might need some support around sleep hygiene or strategies that could help you to fall asleep. But if you're just scrolling Instagram, you know what I mean, at night, or watching Netflix till 3 a.m, do yourself a favor, put it down, prioritize your sleep, and see how you feel.
Yeah.
Physical activity is another big one. We used to think that the decrease in physical activity that we see in people who are depressed is always a symptom of depression or caused by it. And now there's actually newer research that suggests it might actually contribute to the development of depression. So it's not just a symptom. It actually could be a cause too. So look, you don't have to do CrossFit for an hour every day. Go out for a walk around the block. Do 15 jumping jacks in your living room. I don't care. Move your body, right? I don't care what it is. Get your heart pumping, get those endorphins going, those feel-good hormones. That can really help as well.
Yeah.
And then the last thing I would say is before pursuing counseling or anything intensive from a mental health perspective, some people might want to just go to their GP and get a general checkup. Yeah. There are a number of medical conditions and nutritional deficiencies that can lead to some mood issues. So thyroid conditions can lead to depressive symptoms, low vitamin D. There's a lot of potential factors there. So it can't hurt, right, to go and check out, make sure that everything's functioning as it should be, and get treatment if you need it to see if you're still feeling depressed after that.
Yeah, that's a nice comprehensive list for someone who's like, I do feel off. What do because I think it can be really overwhelming if you're like, it's been a couple of weeks, maybe, especially in this period of strangeness, which we'll talk about more in a little bit, to think like you just have to go all in right from the get-go. That's like a very helpful and doable, like comprehensive list to kind of start. So
back to basics, right?
Yeah, that's awesome. If someone sees someone that they love, so if they have a loved one that they suspect is going through depression, what should that person do? What does empathetic support look like from someone whose loved one is suffering from depression?
Yeah, I mean, I think we can all draw from our own experience with this. How would I want to be treated, right, when I'm struggling? What do I desire and need from the people in my life when I'm having a hard time? Really, I think the most critical thing to remember is that oftentimes people with depression are just needing to be heard and seen. And that's really the basis of counseling and where the healing starts, is this experience of being heard and validated and unconditionally supported, no matter what their feelings are, even if they're ugly or not socially acceptable or whatever the perception is that the person has. So I think we need to remember that if when I'm suffering, I want to be heard and listened to in a non-judgmental place where I can just speak what I'm feeling and experiencing, that's really important, right? That's likely what other people are needing as well. So you can say things like reflecting what you're hearing. So I hear that this time has been really difficult for you. I'm so sorry that you're struggling. Can I help in any way, right? Avoiding the problem-solving temptation, which I think is really common, right? We all want to like, here's the problem, right? I can fix it. Yeah. And I think even as therapists, we're tempted at times to say, I see what the problem is and I know how to fix it. Like, but really we have to start with the connection piece and the validation and making space for people to feel safe emotionally. Because without that, it's kind of a non-starter.
Yeah, that makes complete sense. So, unfortunately, of course, sometimes death by suicide is a result of extreme depression. And in some Colorado counties, suicide is the leading cause of death for individuals aged 10 to 34. Why is this the case, and how do we help prevent death by suicide?
So, Colorado does have an alarmingly high suicide rate, both in young people and in adults, basically in people of all ages. We do need to remember with the statistics for young people that young people just die less frequently than older people. So when we're looking at this has become the leading cause of death, we have to also remember there's not as many causes of death typically for people who are, 10 to 18 or 10 to 34.
Right.
So that's important. However, this is a big problem. So I don't say that to minimize the actual what's actually happening here. And actually, the teen suicide rate in Colorado increased 58% between 2016 and 2019.
Wow.
So something is going on.
Yeah.
Wow. There is a concerning trend here. Sorry, my neighbor's dogs are. Okay. I have a 2.5-year-old, and so inside the house, this was not going to be productive. So no. I apologize for any noise.
That is okay.
So there's definitely a concerning trend here with suicide among young people. The why is obviously a very complex thing to be considering. So we know the risk factors for suicide. This has been really well studied. Anybody who has a mental health condition, so a diagnosed anxiety or depressive disorder, bipolar disorder, schizophrenia, any kind of diagnosed condition, family mental illness, any kind of trauma history, so physical, emotional, or sexual abuse puts somebody at a higher risk of suicide. Access to means, so if there's a gun in the home that they know they can access, or access to medications, for example, that often parents don't think about that. They've got their medicine cabinet full of oh, it's just that that narcotic from my knee surgery. You know, I don't use that stuff, but it's there in case I need it. Well, and then a teenager in crisis could find that. So access to means is a big risk factor. You know, divorce and familial instability, we know, is a factor that contributes to mental health issues for kiddos as well. I think one of the topics that I am just really eager to learn more about and discover as time goes on, and I think the research, we're just starting to get some research really in this area, is the effect of social media on our young people.
Right.
And so we already know that social media use can contribute to feelings of depression and anxiety in adults as well. That's just generally, just from the scrolling, like 20 minutes of scrolling and you feel worse about your life after than you did before. For teenagers who I think are just so vulnerable, they're at the stage of their life where I don't know who I am, I feel awkward, I don't feel good in my skin, maybe I'm struggling with body image issues, or I don't have the friends that I would like to have, that person's more popular. And then social media kind of like is like gasoline on the fire, right?
Yeah.
We've created like an echo chamber for all of those difficult experiences of adolescence.
Yeah.
So I think it'll be interesting to see as the research continues to develop and emerge in this area. But the other piece is teenagers are really impulsive. And so if they have a moment of feeling really down and hopeless, and they have a thought of ending their life, and that means to do so is within their grasp, they can access it, they're much more likely to act without thinking through long-term consequences.
Right.
So all of these things combined with this is a really kind of difficult time, and the world is in a really difficult state right now. Kids have to go to school with the fear of shootings. You know, the political climate is hostile. In many ways, adults are acting like children, right? So I think it's just a difficult environment for kids to feel safe and be able to just grow and figure out who they are. They don't have that safety and security.
Yeah. So is there anything that we can do to help prevent it? Or, I mean, this goes kind of in hand with what we were talking about. Like if you have a loved one who's suffering from depression, I imagine it's similar kind of things that you can do. But is there anything that we can do?
Yeah, I mean, I think encouraging healthy relationships and environments for kids to develop healthy relationships is really, really good. I've worked with a lot of teens through the years who have just said that like their youth group was just this amazing place for them and this source of unconditional love and acceptance, and they felt really safe and loved there. So I think fostering those environments, those spaces for kids to feel safe and talk about what's going on in their lives. I think the most important thing to remember is that if you ever think that somebody that you know might be at risk for suicide, that asking them is actually the best thing you can do. So people have this fear that if they ask, they're going to give this person the idea.
Right.
And we know from the research that's not how it works. So you can't make someone think of suicide who wasn't thinking of suicide. So they're not going to get the idea because you asked them. So I think that's important to remember. If you have any questions, don't shy away from it. If you have fears or concerns about somebody in your life, ask them directly. It seems like you're really struggling. Have you thought about ending your life? And, you know, if it's a no, it'll usually be an emphatic no, right? Gosh, no, of course not. Okay, good, right? That's good to hear. Please tell me if that changes, right? But if they say, I've had thoughts sometimes, like, then that needs to be addressed, right? Access to treatment or a barrier to treatment is actually another risk factor. So if someone's struggling with depression and their parents don't want to get a kid, for example, into therapy, that could be a risk factor for increased risk of suicide.